However, one of the most urgent priorities is addressing high rates of new HIV infections among our young girls and young women. In 2024, here in Uganda, young women aged 15 to 24 accounted for 78% of new HIV infections among adolescents, compared to only in the same age group. This disparity highlights the urgent action needed to ensure that infections among young girls are not at this high level. This is not unique to Uganda. In Eastern and Southern Africa, the region most affected by HIV globally, adolescent girls and young women remain disproportionately impacted. They are about 3 times more likely to acquire HIV than their male peers. And in no way does it mean that young girls have, more frequent sexual interactions than boys. That is not how this should be interpreted. We should interpret this in terms of their biological vulnerability, in terms of the likelihood of young girls facing sexual and gender-based violence, and also in terms of intergenerational sex, where older men are having sex, unfortunately, with our young girls. And so these intergenerational sexual encounters expose them to HIV infections. In 2023, an estimated 210,000 young girls aged 15 to 24 acquired HIV globally, with 77% of these infections occurring in sub-Saharan Africa and nearly 60% in Eastern and Southern Africa. Gender inequalities, poverty, and limited access to sexual and reproductive health services continue to drive the vulnerability among young girls. UNAIDS proposes 5 strategies to reduce new infections in young girls. The first strategy is that we must scale up sexuality education and empower young people with accurate information. When you look at most countries, the knowledge of comprehensive HIV information is only at about 70%. This needs to be improved. Secondly, we have to expand access to HIV prevention tools for young people, including PrEP, the pre-exposure prophylaxis, condoms, and we must provide testing, not just in health facilities, but also in communities and in places where young people are, such as schools, higher institutions of learning, and others. We are also encouraging countries to give young girls choice. Now in the HIV sector, we have a lot of interventions that young people can use to prevent HIV infections. Let's give them choice. I think the media covered the lenacapavir very well, I think a few months ago. This is available. We also have condoms. We have the oral PrEP. We have the ring. There's a lot of choice that is available for young people. Let them get choice and choose what best suits them to prevent HIV infection. Thirdly, we have to strengthen community-led initiatives that address stigma and discrimination and gender-based violence, and ensure that young people who face gender-based violence are referred for services, including HIV prevention. Fourthly, we have to invest in economic empowerment programs for young women and girls to reduce their vulnerability and ensure that they remain in school and complete secondary school education. Finally, we have to ensure youth participation in policy making and program design because young people are not just beneficiaries of services, they are leaders, they have knowledge, they know what works, and we have to give them the space to do what best suits them. The upcoming National HIV and AIDS Symposium is an opportunity to reflect on our progress, to share innovations, and recommit to ending AIDS as a public health threat by 2030 here in Uganda. It is also a platform to amplify the voices of communities, especially young women, young men, and key populations. And so I hope to see many of you with us in Mbarara as we amplify these voices. As the media, we call you to be responsible, to make sure information is reaching, to counter-check facts. The Uganda AIDS Commission is always available. The Ministry of Health, UNAIDS is here. Counter-check facts, also including with people living with HIV, and make sure that your stories, the stories you're covering, are factual. We are very happy that later this year, I think it's this year, we will be participating in an event to recognize responsible media coverage on HIV together with the Uganda AIDS Commission. As World AIDS Day approaches, let us reaffirm that true transformation demands political will, it demands sustained investment and inclusive partnerships. We must protect the gains we've made and push forward with urgency and with unity. Let us all together build a sustainable HIV response that leaves no one behind. I thank you, and I look forward to seeing you in Bushenyi.
The Bushenyi is one of the 3 districts in western Uganda which has a higher prevalence rate of HIV. For us as Bushenyi, we stand at 8%, and the national prevalence rate is at 4.9. When you see that, we are bad off as far as health concerns are. 2, when you look at the number of people that are affected by AIDS, so far we have 22,700, and the number of those who go for treatment stands at 17,900 people who are on treatment. On the issue of activities done, first of all, we have made an MOU with the Uganda AIDS Commission, and it was done on the 7th of November 2025, and we are moving very well, and we are working in conjunction with them to make sure that at least the event becomes colorful. So far, we have notified some of the key institutions to participate in the World AIDS Day celebrations. We've worked with Rotary Club, Lions Club, civil society, especially Western Coast Civil Society Organization and others, Uganda Red Cross, National Water and Sewage Corporation, hospitals like KIU, Kampala International University, Ishaka Adventist Hospital, Kombon, and many others. With the other implementing partners like JRC, Mayanja Memorial Hospital Foundation, to support HIV activities like testing, provision of condom, and others. We've also approached churches, mosques, and they were tasked to make sure that they create awareness in churches and mosques. And we went ahead and looked at included schools, especially secondary schools, to make sure that at least we have we give awareness to our students and pupils in those various schools. We made numerous talk shows on radio stations, both in Bushenyi and Mbarara, to make sure that the day becomes colorful. Last but not least, We are having Empumo Marathon. Empumo means, it is a Kinyankole word, means that we are going to use energy on how best we can educate our community to be aware of AIDS and HIV. And we are having Empumo Marathon on 30th of November this month. It will be held in Ishaka, and I'm inviting you all to participate. We've made strategies of mobilization. I had told you the issue of radio stations, radio shows, TV shows. We've made banners, political rallies, using local leadership, writing invitation letters to make sure that many people attend. And lastly, the proposed activities on the day includes radio talk show, general cleanliness around the town that is going to host, which is Tizinda Town Council, HIV activities like testing, provision of condoms, refilling condom dispensers in HIV hotspots like Mashonga, Butare Town Council, Tizinda, Ishaka Ushenyi Municipality, Nyakabirizi, and other towns. And lastly, we are having the bands and other local artists who will participate on that event. And I cannot forget to thank His Excellency the President for his initiative in fighting HIV and AIDS.
I am Semambo Joel, a young person living with HIV from Mr. White Plus Central Region 2020-2021, and currently working as an advocacy associate with NAFUFANO. NAFUFANO is a national forum of people living with HIV networks in Uganda. It was formed in 2003, now 22 years. NAFUFANO coordinates 135 districts of people living with HIV forums, 18 national networks, and 10 city networks. NAFUFANO's main goal is to ensure PL-HIV live longer, healthier lives. We are 1.49 million people living with HIV. Of these, 1.3 are on ART and 200,000 not yet in care. Through the positive living, we have contributed to reduction of HIV prevalence to 5.1%. However, we are still faced with high burden of HIV, especially with 37,000 of these 14,000 among the adolescent and young people, 14 to 24 years, and vertical transmission of 4,700 and 20,000 AIDS-related deaths. Young people aged 15 to 24, particularly adolescent girls and young women, remain the most affected group. Getting to the role of the PL-HIV in ending AIDS as a public health threat in Uganda, we support to identify and link to PL-HIV into care, especially now that 200,000 individuals not yet in care through widespread testing. Continue to mobilize PL-HIV through our treatment literacy programs and ensure HIV transmission is prevented through the U=U, especially for discordant and mobilized community for prevention by popularizing the innovations, including Lenaka Pavel. Then the next point is to conduct PL-HIV-led research on stigma and discrimination to inform person-centered structure, behavior, and biomedical programs. Then we build capacity of PL-HIV champions, YAPs, mentor mothers, leaders and networks initiatives with skills and in advocacy and research to inform legislation, policy, budget, programs, service delivery, and document live experiences and PL-HIV-led community.
So annually, Uganda AIDS Commission convenes partners for a 3-day National HIV and AIDS Symposium to review and monitor the implementation of the National HIV and AIDS Strategic Plan. During this time, we take stock of the achievements that we have made. We identify any gaps that we still need to address as we race toward ending AIDS as a public health threat. by 2030. I just want to remind you what we mean by ending AIDS by 2030, because sometimes it is not very clear. Sometimes we just say things and it is not very clear. But when we say ending AIDS by 2030, there are three things we are looking at. One, we don't want new infections. And I think you had the number, 37,000 people having new infections last year. That is a big number. We should not have that number. So when we say zero, we want to go toward zero. Make sure that everything we do is suppressing and making sure that we don't have new infections. Then we also don't want anybody dying from AIDS, and it is possible. People who are living with HIV, Mr. Semambo can be my witness, are on medication and they are not dying of AIDS. And they will not die young. They will die of old age. The third one is to do with stigma. When there is stigma, people do not go for treatment. People do not go to find medicine. People do not go to test because they are being stigmatized. Or they don't say that they are positive if they find out they are positive. Therefore, they don't go for medication. Therefore, they still pass on this infection. Therefore, they still have children who are born with HIV. So those three things, always remember, whenever we say ending AIDS as a public health threat by 2030, we are looking at those three things. So this year's theme is building a sustainable response to end AIDS as a public health threat. How are we going to do that? We'll feature, first of all, the 17th Joint AIDS Review, the National HIV and AIDS Scientific Meeting. We shall commemorate Phile Lutaya Day. We shall have the HIV financing dialogue and exhibitions, and we shall also provide HIV testing services and other health services. This symposia has been critical in providing strategic focus as well as identifying those areas where we need to accelerate implementation in our fight against HIV and AIDS. Therefore, as we start the first year of the National HIV and AIDS Strategic Plan 2025-26 to 2029-30, we can plan to use the 2025 National HIV and AIDS Symposium to identify those strategies needed to take us to finish the line of ending AIDS by 2030. We always are saying and are very happy to say that Uganda has been a success story in the fight against HIV and AIDS. And I think, Jacqueline, I can say that in the world we are doing quite well. And many people have replicated our multi-sectoral approach with success. So this multi-sectoral response has helped us to deliver on the promising results that we see today. HIV prevalence has come down from 18% in the 1980s to 4.9% currently. But despite the numerous HIV prevention interventions over the 40 years when AIDS was first discovered in Uganda, there is increased engagement in risky sexual behavior. Many are having sex with multiple sexual partners. Many are not using the condom among those who are in high-risk sex areas. They decline in age of sexual debut. Those who are engaging in high-risk sex. Other challenges include widespread self-stigma, low uptake of couple testing. The couples are not testing together. So one goes and tests secretly, finds out they are positive, they come back and keep quiet. They start on medication, they don't tell the partner. They should be going together. So we encourage that people should go for couple testing. And then significant proportions of people, especially men who are living with HIV, do not know their HIV status. The Director General has talked about the 5 pillars. And from the 5 pillars, I just want to pull out 2 of them. Engaging men. I think we were with the Katikiro, and he said that men are the problem. I don't want to say that again, but men tend to be the ones who drive everything, including asking for sex and taking people into beds. Is that right? Men become a problem. So when we engage men and we teach them and we talk to them and they know what to do, I think there's a lot that will happen. The second thing I want to pull out of the pillars, elimination of mother-to-child transmission of HIV. This really is on my heart. Why should we have 4,700 children born with HIV in 2024? And yet we have all the services, all the health centers, all the hospitals can definitely prevent this. But the people who are pregnant are not going to the health centers. They tell them they are positive, they disappear. They have children who are born with HIV when this could have been prevented. So we want to drive this. We hope that this year, until 2030, we shall be pushing that we engage men, we engage pregnant women, so that nobody, the zeros I was talking about, nobody is born with HIV. So with less than 5 years to 2030, we need to ensure that we protect the gains that we have made over the 40 years and also accelerate implementation of those interventions that we know will give us a huge return on investment. So I've talked about the transmission of HIV to babies, yet we have medications. Men should take their partners for antenatal care at health facilities and ensure that this person that he has impregnated delivers at a health facility. So I'm back to men. They are the ones who are doing this. They should also take the pregnant lady where? To the health center. If she's positive, the health worker will give her medication that prevents transmission of the virus from mother to child during pregnancy, during birth, and during breastfeeding. I therefore urge our political, religious, and cultural leaders, the academia, the media, civil society, to present and prioritize elimination of mother-to-child transmission in their work so that we can achieve zero mother-to-child transmission in this country. Innovation.
Those are the districts most affected as you go up to north. The regions with the lowest prevalence remains Karamoja and West Nile. But they seem to be, we see that if we do not work hard these regions, when you look at new HIV infections, they are going up. But we see HIV prevalence in the districts of Nabilatu, of Bim, in the Karamoja region, and also in the West Nile region. So West Nile is white. We can use colors. Karamoja is white. The rest of the country is, maybe you can say yellow or orange, but there is a red band running through, the middle part of the